Welcome everyone to another wonderful episode here at Doctors of Podiatry. This is one of those cases of what not to do. You agree? Yes. This is a young patient who, unfortunately, a couple days ago, her toe got caught on the rug. I suspect that if the toenail was well trimmed, maybe none of this would have happened. You agree?
Definitely.
Definitely. So without further ado, let's take a look, shall we? Okay, so as everyone can see, I think this is also a blessing in disguise, believe it or not. You know, the nail, I think there was an ingrown nail already in the works. There's a seroma, a subungual seroma hematoma underneath here. That's a collection of fluid, Caesar. I would be very careful because it might right in your eyes. Collection of fluid underneath. We're gonna drain it, remove the nail, decompress the area. It's gonna feel a whole lot better.
Was that going on before this happened?
I'm sorry?
That was going on before?
No,
oh.
I think that that maybe an ingrown, even on this side, was already kind of just on its way, an ingrown toenail. Now, I'd like to say two things. A lot of people were asking me the ingrown toenail that we uploaded yesterday, I believe. Some people were asking about the tourniquet. So we decided to use a tourniquet because of the pyogenic granulomas. You know, if not, it would have been a bloody mess. And I wanted you guys to enjoy the video as well. So that's number one. And number two, with respect to this toe, without a doubt, this toe is numb. 100%. And Dr. Wagner, well, why are you using a tourniquet if you usually don't? Again, you know, the patient is taking a blood thinner. So we want to make sure it's not also a bloody mess. So without further ado, Caesar, watch your face. Go ahead and detach the little proximal nail fold here, kind of like that. Very carefully. There's the hematoma. Watch your face, Caesar. I like this technique. Like that. It's already kind of loose. Well, pop goes the weasel. There is malodor, drainage. So there's the hematoma. I'll show you guys something here. Oh. Uh-oh. Nail on the floor. This is like Walmart. We have, ladies and gentlemen, we have a spill on aisle 4, please. Caesar, will you do us a favor? Okay, so we're just basically inspecting the nail bed. This is the connective tissue. This right here, this is connective tissue that attaches the nail plate to the nail bed. So, you know, what are we looking for here? Number one, a laceration on the nail bed. None found. Infection. Decompressed. None found. No granulomas. Nothing to cauterize. Looks nice and clean. For the patient, we'll go ahead and you know, give the patient some post-procedural protocols to follow, some soaking instructions, and look at this. See, look at the nail here as well. We'll go
That's your nail, right?
Absolutely.
Nicer research.
Can you say that louder?
Pincer nail.
Yep. Yep, these are little pincer nails.
And there's nothing to be done, correct?
Trim them correctly. That's
I
it.
always trim them straight across.
So, you know,
Not
this
that
is
one anymore, obviously.
right. But this is a really good little case here. Let's see if we can remove a little bit of this here. Nice and clean. Boing, boing, boing. So what we're going to do, a little bit of the good old schmear. Smear it nicely there. Remove this. Compression there. I don't know, how many people do you think will fall asleep to this, Caesar? Try to go to sleep to this. Watch your camera. We're all done. Thoughts? How did it go?
Wonderfully. No pain whatsoever.
What have we learned from this?
We've learned to keep our nails trimmed straight across and not overhanging the toe. And not working with open-toed shoes.
Aha! I totally agree. Absolutely, prevention is the key. For all the people out there, be very, very careful. You know, this is, the patient was very fortunate just because there was no associated trauma, no fracture. Sometimes what we have historically seen in the past, any associated trauma to the nail bed can be not such a great thing, could be actually catastrophic. The nail bed laceration, very, very, very commonly seen. The nail bed is very sensitive, very fragile. So, and plus there's not a lot of tissue between the bone, right? If this is the big toe, there's two bones, 1 and 2, and this bone here underneath the nail plate, underneath the nail bed, is in very close proximity. So,
is that gone now?
No, the bone is perfect.
No,
the nail is not there. That is correct.
The whole nail is gone.
Right. The nail is on the floor. 1 second. There's a nail.
Wow.
Ready? Wow. So, what I was saying is that sometimes when we have these what we call comminuted fractures, like a blunt trauma, the bone explodes. And then when it explodes, the nail bed also explodes. So bone is sort of coming out of the toe.
Yeah.
Right, exactly. So that's why it's so important for anyone else.
Especially older people like me.
You mean younger? Yes. Caesar, didn't you have this problem once?
What?
Your toe's also kind of funky looking.
They're fine.
So yeah, prevention. So we will continue to do what we do. We're going to continue to educate the world that these procedures do exist, clinical presentations as such that do exist. As always, thank you for watching.